The Mental Health Act's been in place since 1992, and it's fair to say that it hasn't kept pace with how our community and society has changed. So what this is about is really stepping back, taking a look at the legislation, and we're taking a blank slate approach. Actually, what do we really need? What does that mean for people that need to receive care? Does that need to be under compulsion? Or are there other ways we can be providing it? Really, what we want is to move to a mental health act that is a modern act that really reflects people's rights, dignity, addresses issues around coercion and other things that sit within the current Mental Health Act. What we're really looking for is to receive as much feedback as we possibly can. We've opened the engagement and consultation period for the next 3 months through to the 28th of January. We're really wanting to hear from people who use services, people that may have been under the Mental Health Act in the past, particularly interested in hearing from people's families, but most importantly, people with lived experience. What we also know is that Māori and Pacifica are more likely to receive treatment under the Mental Health Act. So this is a very important part of the discussion. And so that's why, as much as possible, we are creating different ways of engaging different communities, both online and face-to-face engagement groups, to hear different people's perspectives.